In this video we will tell you about what is malarial disease. Malaria is a serious disease that has transmitted through a mosquito bite. Female Anopheles mosquito. When it bites, the mosquito injects malarial parasites into your bloodstream. Malaria is caused by the parasites, not by a virus or by a type of bacterium. If it isn't treated, malaria can cause severe health problems such as seizures, brain damage, trouble breathing, organ failure, and death. Malaria is common in tropical areas where it's hot and humid. In 2020, there were 241 million reported cases of malaria throughout the world, with 627,000 deaths due to malaria. The majority of these cases occur in Africa and South Asia. Malaria occurs all over the world and happens most often in developing countries and areas with warm temperatures and high humidity, including Africa, Central and South America, Dominican Republic, Haiti, and other areas in the Caribbean, Eastern Europe, South and Southeast Asia, islands in the Central and South Pacific Ocean of Oceania. Anyone can get malaria, but people who live in Africa have a higher risk of infection than others. Young children, older people, and those who are pregnant have an increased risk of dying from malaria. People who live in poverty and don't have access to healthcare are more likely to have complications from the disease. More than 90% of malaria deaths occur in Africa, and nearly all of the people who die are young children. More than 80% of malaria deaths in the region in 2020 involved children under the age of 5 years old. When a mosquito bites someone who has malaria, the mosquito becomes infected. When that mosquito bites someone else, it transfers a parasite to the other person's bloodstream. There, the parasites multiply. There are 5 types of malaria parasites that can infect humans. In rare cases, people who are pregnant and who have malaria can transfer the disease to their children before or during birth. It's possible, but unlikely, for malaria to be passed through blood transfusions, organ donations, and hypodermic needles. 4 species of Plasmodium is responsible for the malarial infection. These are Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovule, Plasmodium falciparum, and Plasmodium ovule are the 2 most common forms of infection. Plasmodium falciparum cause the most severe infection of malaria. Living in or traveling to regions where malaria is prevalent is the highest risk of contracting the illness. The level of risk is determined by regional efforts to combat malaria, seasonal variations in malaria cases, and the precautions to avoid mosquito bites. These are some common risk factors of malaria disease: staying near to old ponds and lakes, visiting indigenic localities, mosquito-prone areas. The following are at high risk of having malaria disease: infants and children less than 5 years, pregnant women, non-immune civilian and military travelers, disease-naive populations, HIV or AIDS-infected patients. Signs and symptoms of malaria are similar to flu symptoms. They include fever and sweating, chills that shake your whole body, headache and muscle aches, fatigue, chest pain, breathing problems and cough, diarrhea, nausea, and vomiting. As malaria gets worse, it can cause anemia and jaundice, yellowing of the skin, and whites of the eyes. The most severe form of malaria, which may progress to a coma, is known as cerebral malaria. This type represents about 15% of deaths in children and nearly 20% of adult deaths. Other complications of malarial infection are severe anemia, decrease in blood sugar levels, pulmonary edema, acute renal failure. Prevention and control of malaria disease include intake of anti-malarial medications and taking precautions to avoid being infected by mosquitoes. These are some common measures to prevent malaria disease. Usage of environmental protection agency-registered insect repellent. Apply permethrin on the clothes. Usage of mosquito net while sleeping. The water tub should be closed with lids. Stagnant water should be cleared. Apply mosquito repellent with the diflutamide to exposed skin. Drape mosquito netting over beds. Treat clothing, mosquito nets, tents, sleeping bags, and other fabrics with an insect repellent called permethrin. Wear long pants and long sleeves to cover your skin. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.